How many of you have spent countless hours researching the next digital camera that you're going to buy, or walking down the aisles at Sears or Best Buy trying to figure out the next big screen TV? And yet these only cost a couple $100, maybe upwards of a couple $1,000. And when you look at the medical plans and the health plans that you're going to be getting through your employer, most people don't realize that those cost well over $10,000 for the typical family. They're very expensive. Probably the only thing that you'll actually wind up spending more money on is your house and your car. Many people will spend a lot more time picking that digital camera out than actually sitting down and spending time picking out their health plan. And yet it's really quite important for your health. It's really a very major purchase decision that you're going to be making. A lot of people don't realize that you can actually save money on your taxes just by taking advantage of the right health plan with a health savings account or flexible spending account. It's a really important decision. And many people are just totally confused by it, and they're really overwhelmed. After all, what is preventative care, and what's capitation, and what's a copay, and how does that all add up? I really don't know, so I really just won't spend any time on it. There's a really neat tool out there that can help you compare your medical plan options. It can help you actually figure out what the real cost of these plans are going to be. A lot of people, I bet you don't even realize that out of these times, what comes out of their paycheck, probably don't realize that there's a lot of other things that add up, such as the cost of their medical services and the cost of their prescription drugs. They probably don't realize that their employer may even contribute to one of these savings plans that can help them save money. And so we've developed a really neat tool that helps simplify this whole process of comparing your plans and modeling what these different costs can potentially be. The medical cost estimator that Verizon provides is a really simple tool, and it uses some of the latest, newest, coolest technology to help you go in and indicate which of your family members you intend to cover. It also helps you indicate what tax bracket you might be in, so that as you begin to model contributions to these different spending accounts, what the after-tax effect will be. Based upon your covered dependents, based upon how you actually use a medical plan, do you have high health care needs, do you have moderate health care needs, or do you have low health care needs, the calculator will on the fly and instantaneously recalculate all these complicated things that are going on behind the scenes, so you can just focus on, well, which of these plans is the least expensive for me? Here I can see that my employer may actually be contributing $2,000 to a savings account on my behalf. It helps me lower my cost. Here I can indicate, well, what if I wanted to put away a lot of money into one of these new highfalutin health savings accounts? What does that mean on an after-tax adjusted basis? How does that compare to last year when I was actually in an HMO plan and I put $500 into my flexible spending account? Well, it's kind of interesting to note that I can actually save money by going to one of these high deductible plans. I mean, everyone's scared of high deductibles. We don't want to have a high deductible on auto insurance. Why should I have any on my health insurance? Well, it actually, if I'm healthy and have a fairly healthy family, means that I can save quite a bit of money. And what's actually interesting, many people don't know, right below here you can see a lot of that money that you save can actually be rolled over to next year. A lot of people mistakenly remember with flexible spending accounts there's a use it or lose it rule. That means if I don't use the money this year, I lose it. And no one wants to lose a nickel, do they? So it's kind of interesting to note with a health savings account, you can save the money, it can roll over to next year, and you don't lose those monies. So this tool is really good at helping you see what the total cost is going to be. It helps you model contributions to these savings accounts. It helps you see the adjusted costs, and it helps you see how you can save money over time. And that's really kind of cool. If you want to look at this on another adjusted basis, you can just click a simple button and it will flip it over so you can just see the basics of the premium, the services, and the prescription drug costs for these different plans. If you want to drill down into any one of these and see how the different dollars amounts and how the per service usage for the different people in your family are adding up, you can do that as well. It's pretty simple to use as well. If you go out of network at all, you can actually just move this little slider over here and it'll recalculate on the fly. And you can see how this adjusts to take into effect any out-of-network provisions. And behind the scenes, all the rules of this tool are determining how to apply those dollars amount appropriately. Now, let's say you have someone in your family that actually has some fairly major needs, and you want to just get in here and say, for Johnny, what's the preventative care? Perhaps there's a really special prescription drug that this dependent of yours needs to take. The calculator will, on the fly, you'll see how this prescription drug cost went up. It'll take all of this into account on the fly so that you can see the impact of modeling just an individual person. This is a new tool, and you've got to figure out how to use it, but there's a lot of help available to you, so you can come in here and expand this out and learn about what is a flexible spending account, how do you interpret your results. There's also tips available here, so if you want to go through and learn, well, what exactly are services? What's the per-person view, and how does that get used? So there's always accessible to the person, too, a lot of help. You can save your results and always come back and remodel as well, so you don't lose all that work that you did. And so we think it's a really interesting tool that helps a person figure out and really demystify all the complexities around a medical plan, helps them make a far smarter decision when actually sitting down and doing what we're really doing, which is buying health care, and really be more smarter about it. So we want to thank you for taking a few minutes to look at this tool. We think it's pretty interesting, and it will have a really major impact on how people buy health care in the future. Thank you.